I've been in the Medicare business for almost 16 years now. About 4 years ago, we decided to start our Medicare School YouTube channel. During that time, I produced over 400 videos, and people just like you have watched those videos for 3 million hours. And in this video, I'm going to take 15 minutes and give you some of the best Medicare advice that I can give you to make sure that when you go on Medicare, you can do it without any mistakes. In this video, I'm going to address 3 major issues that will help you to make sure you're making the right decisions with Medicare. The first one is this one, starting Medicare at the right time. If you start too early or you come in late, you're going to have penalties, and so we don't want to do that. And so let's start Medicare at the right time. So what happens, there are some of you that have to start Medicare at 65. There's actually 5 groups of people that must go on Medicare at 65. If you or your spouse are no longer working, you have no employer plan available to you, you're going on Medicare at 65. If you're covered by COBRA insurance, you have to start Medicare at 65. If you keep COBRA, which sometimes people do that for a short period of time, it moves to the second payer position. So if you don't enroll in a Medicare at 65 and you have a COBRA plan, you become the first payer. So again, A and B at 65, and then COBRA would pay second. The same is true with TRICARE insurance. You're retired from the military. Medicare has to be in the first payer position, which means you enroll into A and B. TRICARE will be in the second payer position. The same thing happens with a small employer plan. Medicare defines that as 19 employees on the payroll or less. Then what happens is, again, that small employer plan, like COBRA, like TRICARE, moves to the second payer position. So you have to enroll into Medicare A and B to put them in the first payer position. The last group, the 5th group, would be anyone that's covered by an Affordable Care Act plan, the ACA plan. You went through the Healthcare Exchange or the healthcare.gov website and got an individual or a family plan. So what happens is, once you turn 65, all the financial incentives, if you have those, on an ACA plan are eliminated. In other words, there will no longer be any tax subsidy. You're not going to get a reduced premium. There's no cost sharing by the government at 65. And so there's no reason to keep an ACA plan at 65 because all those financial incentives are gone. If you stay on the ACA plan at 65, you'll pay full premium. There's no tax subsidies. There's no reduced premium at all. There's no cost sharing paid by the government. So there's no reason to keep that ACA plan. So you've got to go on Medicare at 65 in those 5 scenarios. Now, if you're on Social Security, you're going to be automatically enrolled into A and B. But if you're not, what happens at 65, if we have to start Medicare, we're going to use what is called the initial enrollment period, the IEP. And here's what you need to know about the IEP. It only lasts for 7 months. And those 7 months are tied to your birth month. 3 months before you turn 65, the month you turn 65, and then 3 months after. And so we have 7 months to enroll into Medicare. And when you enroll into Medicare, it determines when they're going to start your coverage. So if we enroll the 3 months before we turn 65, our Medicare A and B starts on our 65th birth month. But if I wait for whatever reason, if I enroll my birth month, they start me the next month. If I wait 1 month, they'll put me off another month. So the point is they delay our coverage if we do not enroll the first 3 months prior to turning 65. So if you need to start at 65, then you want to be sure to do that those first 3 months before your 65th birth month. That's called the initial enrollment period. This can all be done online. It's a very simple process. You work with us or someone that can walk you and guide you through the process. Now, I want to talk to those of you that are going Medicare after 65, and this is only one group of people that can do this, and that is anyone who is employed or their spouse is employed, and you're going to keep that employer-provided plan, and there's 20 employees on the payroll or more. 20 or more. You don't have to do anything at all with Medicare. You don't have to do Medicare A, and you don't have to do Medicare B. Neither one of those at all. Now, up here, we had to do both A and B, right? Because we had to put Medicare in the first payer position. But here, we don't have to. Now, some of you may decide that you want to do A only if you keep working, and you'll pick up B at a later date, all right? But want to make sure that at 65, you're not required to go on Medicare. But once you've lost that group plan, that was this 20 or more, and now you're ready to retire, your spouse is going to retire, and you're going to lose that plan. Now we're going to come into Medicare after 65. This initial enrollment period is over. We're 67, 68 years old, and we're going to use what is called the SEP, which stands for a special enrollment period. And the difference between the SEP and the IEP is this one, we have to prove that we've had credible insurance and employment at work or your spouse's work all the way back to 65. The form we prove that with is called an L564. Your HR department actually fills this out. And we have one more form that's part of this process called the CMS 40B. And this form is the form that we use to let Medicare know when we want to start our Medicare coverage. So if my group plan ends June 30th, I would put on my 40B form, please begin my Medicare July 1. So the L564 proves I've had credible coverage and I'm eligible to come in with an SEP, no penalties, no problems. The 40B is the form we use to select when we want to start that coverage. All right, so that's the first decision you have to make, going on Medicare at the right time. All right, that brings us into the second issue that we want to address during this brief video, and that's selecting the right insurance plan. We go on at the right time, and now we want to make sure that we select the right insurance plan. Now, there's really only three ways to use our Medicare coverage. The first one is to do A and B only. Now, in my opinion, that's the worst choice. There's a tremendous amount of risk financially to you, so I wouldn't do that, but that is one choice. The second choice would be to do A and B with a supplemental plan. So I enroll in traditional Medicare, but I get a supplemental plan to fill in those gaps. All those gaps, or most of those gaps. Up here, I'm responsible for all the gaps. That's why I think that's the worst decision. And then this one would be a good decision here to take the liability of those gaps and transfer that to an insurance company, and we call those Medigap policies or Medicare supplemental policies. The third option, which is still a good option, would be to enroll at A and B, but notice we replace that by a private health insurance company, and these plans are actually called C plans or Advantage plans. All right, so if I were making a decision, this wouldn't be something I would ever do, too much financial risk. So I'd boil this down to either number 2 or number 3, and what you have to do is decide which one of these is going to be the best for you. So let's compare those two plans. Hey, if you found this video helpful and you want to see more Medicare information just like it, then go below, right below the video, and you can give us the thumbs up as well as subscribe to our channel. And every time I put a new video, which is about 2 every week, you'll be notified of that video, and others just like you who need this vital information will get it as well. So just as we get into these differences between these plans, I do want to just make a quick statement about this. When we talk about supplemental plans, these are also called Medigap policies. They're all the same. Now, the majority of people today that are getting plans, they say about 70% of people getting SUPs today get G plans, about 30% get N plans. Both are wonderful options, just depends on what you're looking for. G is going to have a little bit of higher premium, a little bit more comprehensive coverage. N is going to have a lower premium, and you take on a little bit more risk, but not a whole lot more. But the point is, either one of those really will be good. You just have to decide financially which one you're going to be most comfortable with. But as we talk about these features, the features exist between the G and the N, so they'll be identical there. Now, when we talk about Advantage plans, these are called C plans or replacement plans, all right? And so it boils down to how do you want your insurance to work? That's really the differences here. So you have to, of course, make that decision. So let's look at these difference between these two plans. So first off, if you're concerned about providers, and most people are, their doctors and hospital choices, if you want to go to any provider that is available to you, then what happens in that scenario, the supplemental plan is definitely going to be your favorite here, because you can go to any Medicare providers, meaning as long as that provider takes original Medicare, they will take your supplemental plan. They're required to, so you don't have to worry about it. Not so with Advantage plans. These plans work through networks. These are going to be HMOs or PPO plans. All right. So if you want to go to any provider, again, you would select a MedSup plan. If you're not so particular about that, where you're saying, "No, I'm fine with network plans," then again, an Advantage plan may be in your best option. Now, the second difference has to do with national coverage, meaning when you pull that card out, regardless of where you are, whether you're in Alaska or Florida, where you're in your home area or you're on vacation, if you want a plan that's going to be a national plan where there's no difference at all in the benefits and the coverage, then again, that's going to be on the supplemental side. Because what happens over here on Advantage plans, because of the networks, you have local plans and you have regional plans, but there's not going to be any kind of a national plan whatsoever. Doesn't mean you don't have coverage, because you would have, but that coverage could look a little bit differently outside of your plan area versus a supplemental plan. You pull out A and B with your supplemental plan, again, it's a nationwide plan. The third issue would be a lifetime versus an annual policy or a portable policy. Now, lifetime means that policy can never be canceled by the insurance company unless you don't pay the premium. And again, that's where your supplemental plan is going to be favorable here, because they're lifetime policies, plus they're portable, which means if I live in Alaska and I want to move to Florida, you can take your supplemental plan with you because it's tied to you. It's a lifetime plan, can never be canceled except by non-payment of premium. With Advantage plans, they're not lifetime, they're an annual agreement between the insurance company, you, and Medicare. And you don't take those with you. You move from Alaska to Florida, you're certainly going to have to get a different plan. And so the point is, that's the way that is going to work. Not going to be lifetime or portable, either one. Next item would be pre-authorization. Now, pre-authorization means you need a healthcare service that's expensive. Could be an MRI or a CAT scan or a PET scan, maybe an extended skilled nursing stay. Could be a knee replacement or a hip replacement, but something that's expensive. And so if you have a pre-authorization, what happens is, that means the plan, the insurance company actually has the final say-so with that decision, meaning doctor recommends, but if it's a pre-authorization, then the plan, the insurance company gets to approve that, and it has to approve that before you get coverage. So again, on the supplemental plan, we never have those at all, but we're going to have that about 70% of the time with Advantage plans. It's going to have a pre-authorization, which means the insurance company has the final say-so. Over here, insurance company has no say-so whatsoever. If doctor says you need it, Medicare says we'll cover it. The supplemental plan has no way to intervene, to delay, deny coverage. They have to cover it as well. All right, the fifth item here would be referrals, meaning if you want to see a specialist, do you have to get that referral from your primary care doctor? And again, that never happens on supplemental plans at all. You can call up your dermatologist or cardiologist and make an appointment. You don't have to have a referral whatsoever. Many times, especially on the HMO plans with Advantage, the primary care doctor has to make that referral before you can see a specialist. Number 6, predictable cost. If you're looking for predictable costs where you're not going to ever be surprised by a bill, wondering if you feel like you're getting dollar to death on this plan, then that again is going to be your supplemental plan, because predictable, you know your premium, and if you have a G plan, you have to meet the deductible once a year. On the B side, the N would have some co-payments with it, but the point is you're paying a premium and pretty well getting rid of all the other out-of-pocket expenses. Over here, what happens is you're going to be responsible for what we call a max out-of-pocket. We call it a MOOP, and those could be anywhere from $3,000 a year upwards to $10,000 a year. And so again, this plan is a pay-as-you-go plan, and so you don't know what your costs are going to be. Now, if you don't have any health problems, they'll be very reasonable. But if you had cancer or something like that, then these are definitely going to be a whole lot more expensive than what you'd pay with a premium on a Medicare supplemental plan. All right, almost done here. Now, this is the one item that both of these have in common, and that is to have either a sup or an Advantage plan, we have to be enrolled in A and B. It's the only thing they share in common, enrollment in both A and B, which means we have to pay our B premium, which this year is $185 a month for most people. So I'm going to have to pay that. When I'm over here, I'm going to have to pay my B premium. Over here of $185. A for most people is going to be $0 for Medicare Part A. So I have to pay my premium. Now, the next item has to do with the premium for the insurance, meaning over here, I always have a premium for that plan. And that could be $100, it could be $130, $140 on a monthly basis. Over here, most of these are going to have a $0 premium. They say right now, there's about 3,500 plans available throughout the country, and about 2/3 of those plans have a $0 premium or a very low premium. So if we're looking at premium only, then certainly this Advantage plan is going to win that out if we're just looking at the monthly out-of-pocket expense, because this is going to have a premium that will not. And then lastly, when it comes to perks, perks would be a dental allowance or a vision allowance or a gym membership or hearing aids. Again, over here, we're going to see that a lot when it comes to the Advantage plans, because that's kind of what they offer. They're usually offering some kind of perks. Over here, this is just simply going to be pure quality insurance. And so people are looking for perks, then they're probably going to favor an Advantage plan. Those who are looking for high quality insurance are going to say, no, I'll pay for my own dental plan. I'm not going to use a gym membership anyways, and I don't need hearing aids or whatever. And so they don't go after the perks. So you can see these plans are totally different. And what you have to decide to make the right decision is, how do you want your insurance to work? Because this decision here is very, very critical, because if I go with this situation here, I have a lifetime plan. I go over here, they're annual plans, and if I stay on this plan for a year or 2 or 3, 4, 5 years and want to move from here over to here, I have to go through medical underwriting to make that switch. All right, and so I'll explain that on the next slide. Hey, if you've come to the place where you know you're going to have to make some Medicare decision pretty soon and you want to make the right one of the best ways to do this is to go down below, and you'll see in the comment section there, the very first pinned comment at the top. You can actually click on the link there and you will book a call. And you'll book a call with one of our Medicare guides. All the guides with our company, I have personally trained them. They're professional, they answer all your questions, and they'll show you your Medicare options so that you'll be confident in your decisions. Let's get back to the video. All right, that brings us then to our final issue. We know we have to go on Medicare at the right time. We want to get the right kind of insurance coverage. In other words, how our insurance is going to work. We have to make that decision. And then we want to make sure that we're real clear on how plans can be switched, because over time, people do want to switch plans, but there's certain rules you have to be aware of. So let's talk about our options for switching. So if you take an Advantage plan, what happens is you can switch to another Advantage plan actually twice a year. This is October 15th through December 7th. You can make that switch. Or you can also make that switch January 1 through March 31, okay? Now these are called different. This one over here is called the annual enrollment period. This one over here is called the open enrollment period, but we have two different times a year. So as long as I have an Advantage plan, I can switch to a new Advantage plan. If I switch here, October 15th, December 7th, my new plan will start January 1. If I make a switch the first quarter of the year, I can do it one time during those 3 months. If I make the switch in January, my new plan begins in February. Switch in February begins in March. Again, switch in March, it's going to begin in April. So I can do that every year. And there's no underwriting required. As long as that Advantage plan is in your zip code, you can get a new one during those times of the year. The next opportunity would be a supplemental plan to an Advantage plan. So we saw the differences. So this is someone that says, you know, I don't want to pay a premium any longer. I'm fine with pre-authorizations. I'm fine with networks. I'm fine taking on the risk of max out of pocket, all that. And they want to move to an Advantage plan. So what happens in this scenario, it's only one time a year, and that would be October the 15th through December the 7th. We can make that switch. The new plan would start January 1, and again, there's no underwriting. The Advantage company is required to take you as long as that plan is in your zip code. The third option would be drug plans. So when I have a supplemental plan, I also have to have a drug plan. And so when I get a drug plan, I can make switches year to year on drug plans. Again, the dates are October 15th through December 7th. And so it could be that you're on a drug plan and next year you're taking more meds, or next year you're taking less meds, and you want to get a better plan, a different plan, cheaper plan. And so what happens here, you can switch drug plans, those periods of time, and again, the new drug plan would start January 1st. Again, no underwriting. Insurance company has to take you as long as the plan's available in your zip code. The fourth option would be someone that's on an Advantage plan and they want to move to a supplemental plan. And again, it's just like it is up here. We can do this twice a year, and that would be October 15th through December the 7th. And then again, the first quarter of every year, January 1 to March 31, we can make that switch to a supplemental plan. But what you have to realize here, now we have to go through underwriting. If I've been on the Advantage plan for a year or longer, what happens to make that switch? Now the insurance company does not have to take me. They have to take you the first 6 months of your B date on Medicare, but after that, they don't have to. And so you have to make sure you have decent health to be able to make that switch. And sometimes people are on Advantage and then they want to move to a supplemental plan, but they have some kind of health condition or they're taking certain medications. The insurance company denies the application. All right. And then that brings us to the last one. And this would be a supplemental plan to a supplemental plan. As far as periods of time, you can make this switch anytime. Okay. It's not tied to any of the open enrollment dates whatsoever, sup to sup. But again, in most states, you're going to have to go through that medical underwriting. So we have to ask you some questions to move from a sup to a sup. So we have to start Medicare at the right time, we have to get the right coverage, and we have to understand switching rules, because sometimes people want to switch plans, and so we have to live within those guidelines.